I want to finish this episode of Bipartisan Brief by taking a look at COVID-19, and the chances are we'll be ending all bipartisan briefs with something similar moving forward. And we're going to start with the United States of America. First up, let's do a national summary of the United States, followed by a comparative summary before moving on to the states. As of yesterday, the United States of America has had 1,793,530 total confirmed COVID-19 cases and 105,557 COVID-related deaths. And yesterday we saw 25,069 new cases and 1,212 new deaths. Now, speaking comparatively, looking only at nations that have a minimum population of at least 10 million people and a minimum of 1,000 total cases, the United States ranks, as of yesterday, number 1 in total cases, which is not good, number 2 in cases per million, which is also not good, number 1 in total deaths, which is not good, number 8 in deaths per million, which is not very good either, number 1 in total testing, which is great, number 8 in testing per million, which is pretty good, but certainly needs to be improved. And if we dive into our in-house analytics, comparing 2 weeks ago with the week most recently passed, the USA ranks number 33 in the testing per capita increase, which considering our resources is not very good. Number 19 in the decrease of average daily new cases, which is pretty good. Number 22 in the decrease of average new deaths, which is also pretty good. Remember, we went down in both average new cases and average new deaths, which is good. That's progress. And we had the number 15 overall ranking, which is pretty solid, but considering our resources, we hope we're able to get that up as soon as we possibly can. Now that we've taken a look at the U.S., both internally and globally, let's turn our attention to the states. The 5 states that had the biggest increase in testing in the U.S. over the last 2 weeks were Nevada 78%, Maryland 73%, Wisconsin 72%, Kentucky 71%, and Georgia 66%. The 5 states with the smallest increase in testing as a percent over the last 2 weeks were Idaho at 27%, Hawaii 26%, D.C. at 23%, Utah at 22%, and Washington State at 21%. In terms of percent, the biggest increase in daily new cases comparing 2 weeks ago with this past week was Alaska at 63%, but only 430 total cases so far. Alabama at 39%, Washington 35%, Wisconsin 22%, and South Carolina 21%. As a percent, the biggest decrease in daily new cases over the last 2 weeks came in Delaware, decreased by 38%, Louisiana by 39%, Connecticut by 40%, Rhode Island by 41%, and North Dakota by a whopping 60%. The biggest increase in new daily deaths over the last 2 weeks, looking at it as a percent, Tennessee 80%, South Carolina 64%, South Dakota 50%, Wisconsin 41%, and Virginia 40%. And the biggest decrease in new daily deaths as a percent over the last 2 weeks was West Virginia down 75%, Oregon down 60%, Louisiana down 55%, Kentucky down 54%, and Idaho down 50%. Looking at which states are doing best overall, judged on the measurement of an increase in new testing capacity and how much new cases and new deaths are going up or down. The 5 best states currently in the U.S. by these numbers are Louisiana, Connecticut, North Dakota, Kentucky, and Kansas. And the 5 worst states currently in the U.S. by these measures are Tennessee, South Carolina, South Dakota, Alabama, and Arkansas. We also saw this week for the first time since I started following the numbers that the U.S. has 3 states where average new daily cases rose more quickly than testing capacity. Alaska increased the testing capacity by 44% the last 2 weeks, whereas average new daily cases went up 63%. Alabama saw new testing capacity increase 36%, and new daily cases increased 39%. And Washington State saw new testing capacity rise 21%, and new daily cases rise at 35%. The U.S. also had 9 states that saw increases in both new cases and new deaths. And that's North Carolina, Mississippi, Wisconsin, Virginia, Arkansas, Alabama, South Dakota, South Carolina, and Tennessee. But fortunately, the U.S. also had 26 states that saw both average daily new cases and average daily new deaths decrease over the course of the last 2 weeks. And those states are Louisiana, Connecticut, North Dakota, Kansas, Delaware, New Jersey, Oregon, Georgia, Maryland, Indiana, Idaho, Massachusetts, Illinois, New Hampshire, Texas, Pennsylvania, Michigan, New York, Colorado, Nebraska, Florida, D.C., Minnesota, New Mexico, Ohio, and Iowa. And as this is a political show, for those of you keeping partisan score at home, states controlled by Democrat governors had 39 total reports, 28 positive, 11 negative for 72% positive. And states led by GOP governors also had 39 total reports with 18 positive and 21 negative, or 46% positive. And if you group it by positive and negative, there were 32 states that appeared on these lists negatively. 11 were Democrat, or 34%, and 21 were GOP, or 66%. And if you look at the 46 positive reports, there were 28 Democratic states at 61% and 18 GOP states at 39%. Looking at COVID-19 globally, these are the 10 nations that saw the biggest increase in testing capacity, but the nations had to have a minimum of 1,000 cases and a 10,000 person minimum population. And those countries are Guatemala, 336%, Morocco, 123%, Haiti, 107%, Kenya, 100%, Nepal, 83%, Nigeria, 79%, Venezuela, 78%, Ivory Coast, 74%, Bangladesh, 72%, Indonesia, 64%. And as a point of comparison, the United States increased our testing capacity over the course of the last 2 weeks by 41%. And these are the 10 nations that saw the smallest increase in testing capacity over the course of the last 2 weeks. And again, you have to have 1,000 minimum cases and a 10,000 person minimum population. Uzbekistan, France, and Egypt were flat. Mali went up 6%, Spain 17%, Japan 18%, South Korea 19%, Malaysia 20%, the Netherlands 21%, and Ghana 21%. Sticking with the 1,000 case minimum and 10,000 person minimum population, these are the 10 countries that saw the biggest increase in average new daily cases over the last 2 weeks. Sri Lanka 268%, Thailand 225%, Nepal 180%, Iraq 147%, Malaysia 111%, South Korea 109%, Philippines 102%, Guatemala 85%, Tunisia 77%, and Bolivia 76%. And these are the 10 nations that saw the biggest average decrease daily in new cases. Again, 1,000 cases minimum, 10 million person minimum population. Zambia minus 48%, Spain minus 45%, Greece minus 45%, Morocco minus 44%, Ecuador minus 37%, China minus 37%, Japan minus 34%, Cameroon minus 28%, Italy minus 25%, and Somalia minus 25%. These 10 countries saw the biggest spike in average daily new deaths as a percent. 1,000 case minimum, 10,000 person minimum population. Kenya 140%, Sudan 109%, Kazakhstan 100%, Haiti 100%, Guatemala 68%, Philippines 67%, Sweden 52%, Egypt 50%, South Africa 43%, and Somalia 38%. These 10 countries saw the biggest decrease in average daily new deaths as a percent. Malaysia went down 100%, China went down 100%, Spain went down 70%, Czechia went down 61%, France went down 56%, the Democratic Republic of the Congo went down 54%, Tunisia went down 50%, Uzbekistan went down 50%, Cuba went down 50%, and the Ivory Coast went down 40%. And these are the countries that had the best overall score in terms of new testing capacity, combined with whether or not average daily new cases and deaths are going up or down. Morocco, Spain, Greece, the United Kingdom, Ecuador, Italy, Czechia, the Ukraine, Germany, and Senegal. And these are the countries that are currently doing the worst in terms of that comparison between new testing capacity and whether new deaths and new cases are going up or down. Iraq was the worst, then Algeria, then South Korea, then the Philippines, then Nepal, then Kenya, then Egypt, then Kazakhstan, then Bolivia, and then Haiti. And there are, unfortunately, a lot of countries this week whose new cases went up a lot more rapidly than their new testing did. And for this, we're using just the 1,000 case minimum. We're dropping the population requirement. The countries that are currently upside down in this ratio are Sri Lanka, 45% increased testing, 268% new cases. Thailand, 31 versus 225. Israel, 6 versus 191. Nepal, 83 versus 180. Iraq, 50 versus 148. Malaysia, 20 versus 111. South Korea, 19 versus 111. Philippines, 102 versus 155. Iceland, 7 versus 100. Panama, 32 versus 97. Albania, 21 versus 82. Tunisia, 27 versus 77. Bolivia, 51 versus 76. France, 0 versus 69. Slovenia, 15 versus 67. Costa Rica, 31 versus 63. Mali, 6 versus 58. Colombia, 49 versus 54. Argentina, 49.9 versus 50.5. Armenia, 44 versus 46. Oman, 18 versus 40. Egypt, 0 versus 38. Democratic Republic of the Congo, 0 versus 37. Ghana, 21 versus 33. The Maldives, 0 versus 30. Azerbaijan, 26 versus 30. Uzbekistan, 0 versus 29. And lastly, Estonia, 19 versus 27. And we also saw quite a few countries that are going in the wrong direction with both new cases and new deaths rising over the course of the last 2 weeks. And those countries are Iraq, South Korea, the Philippines, Guatemala, Bolivia, Honduras, Gabon, Colombia, Kenya, Argentina, Armenia, Egypt, South Africa, Peru, Azerbaijan, Chile, Mexico, Estonia, India, Bangladesh, Kazakhstan, Brazil, Qatar, and Sweden. Fortunately, we saw slightly more countries that are going in the right direction, with average daily decreases in both deaths and cases, again, 1,000 case minimum. Bulgaria, Luxembourg, Spain, Greece, Morocco, Serbia, Latvia, Mayotte, Switzerland, Ecuador, China, Japan, Iceland, Guinea-Bissau, Cameroon, Slovakia, Italy, Finland, Tajikistan, Norway, Germany, Denmark, Belgium, Bosnia and Herzegovina, the UK, the UAE, the United States, Czechia, the Ukraine, Equatorial Guinea, Turkey, Singapore, Poland, Pakistan, Guinea, Romania, and Iran. And now that we've gone through the data, we're going to finish up this episode of Bipartisan Brief via an interview with a local doctor in Mexico City named Jorge Ruiz, who works inside one of the public hospitals. Welcome back to the Bipartisan Brief. I'm joined today by Dr. Jorge Ruiz in Mexico City. And the first question I have for you, doctor, is fill us in a little bit about how the healthcare system overall works in Mexico.
Well, first of all, Peter, thank you so much for having me in your program. It's an honor for me. And well, I think it's important for Mexican doctor to speak out what's really happening here. And well, first of all, I'm Jorge. I'm 27 years old, and I'm a physician here in Mexico City. I actually work in an ER department in a big public hospital. And well, overall here in Mexico, we have a healthcare system which works pretty much for free. I mean, everyone here is allowed to go to any hospital, and you can ask for attention without having to pay anything. More important, nowadays with the COVID-19 thing, every hospital, it doesn't matter if it's private or if it's public, it's for free. So that's amazing. I mean, for a point of view where we are a third world country, I mean, that's great because anyone, it doesn't matter if you have the money or not, you're going to get the right attention, the right medical attention.
So a follow-up there. So
yeah.
if it's, of course, nothing's free, so the taxpayers are funding it. The government's funding
Yeah,
it.
of course. Yeah.
In that situation, does that mean, like, for example, in England and Canada, my understanding is that a lot of the doctors get their paycheck from the government. Is that the system here, or is it more mixed between private and public?
No, just like that. I mean, we get paid by the government we're actually public persons. I mean, we work for the government. That's right. Well, if you work in a private hospital, yeah, you get paid by that company. But that's the difference here. I mean, for example, in the US or I mean, anywhere else, you have to pay for an insurance, and you don't have to do that here. I mean, you get insurance by the government if you're working, because if you're not working, I mean, you don't get access to public health. That's the thing here. But with COVID-19, it doesn't matter if you have a work or not, you're gonna get the attention.
So a couple of follow-ups there.
Yeah.
This has been a problem in the US where we have, for example, we had a $1,200 stimulus check, but you had to meet certain qualifications in order to receive it. Or with the unemployment benefits, of course, you had to have been employed in order to receive unemployment if you get laid off. So, for example, there's so many people who are working, but they're more in the street or cash economy rather than a traditional 9 to 5. So I wonder about like all the street vendors, are they covered or are they an unprotected class?
No, they cover, man, and that's amazing. I mean, I believe that that's great because, as you say, I mean, 50% of the population here works on the streets. I mean, they sell things or they prepare food. I don't know, but yeah, I mean, they can go to any hospital in this moment. They can go to any hospital. They're gonna get the proper attention. Yeah, it doesn't matter if they're working or not.
Yeah, so I know in this moment the government's stepping up, even in the U.S., where of course we're very, where a lot of the powers that be are fiercely protective of our private system. Even 2/3 of the Democrat senators are against universal coverage or Medicare for all or socialized medicine, whatever verbiage you choose to use. But right now, the U.S. does have socialized medicine. We're covering COVID cases.
Nice.
I'm curious, independent of COVID, do the street vendors get coverage generally, or do they have to have, is there some other system for those folks, or how does that work?
Yeah, there's another system, but they cover. I mean, basically here in Mexico, we have two types of medical coverage, for say. We have private coverage, which you pay an insurance to any company, I don't know, any name of any insurance company you want, and you're gonna get private facilities. But if you are like 99% of the people here in Mexico, which we don't pay for an insurance, we get public health. And in public health, we have three big institutions, which is IMSS, Instituto Mexicano del Seguro Social, which is the biggest one, and the better one, if I may, we have ISSSTE, which is another kind of public health. We have the ones that are provided by the government itself, which that one is the one that cover everyone. I mean, if you don't have work, if you're in the street and you need to do, I mean, anything, you can go to those hospitals and you're gonna get the attention and you don't have to pay for anything. So yeah, that's in a scenario where we don't have COVID-19. Yeah, you're still covered, so that's great too. But you can't go to a private facility, or you can't go to certain hospitals, but you still get covered.
I think that's very similar to Medicare and Medicaid, the public, and for that matter, the VA, the Veterans Healthcare Administration, where you have coverage, but you can't necessarily pick exactly
that's right.
list you go to. I'm also curious, one more follow-up before we move on, and you may not know this exactly off the top of your head, but what is the breakdown? Like, I think in the UK, it's something like 10% of the healthcare system is private, 90% is public. Of course, in the US, it's more like the other way around. Do you know that off the top of your head, or do you not?
I don't know the exact number, but if I have to guess, I think it's 90-10. 90% public health and 10% private facilities. I mean, 1 out of 10 can't pay for an insurance here in Mexico because it's not something we do.
Got it. And so now I'm curious, moving on.
Yeah.
What are you seeing with your own eyes? You're working in the hospital system. Are they at capacity or near capacity or over capacity, or is this thing trending in a good direction or a bad direction? I'm curious to get a firsthand account of what you're actually doing and what you're hearing from your various friends who are in your profession as well.
Yeah, well, getting in this topic, fully talking about COVID-19, it's a thing that in Mexico, we start to see in late. I mean, the first case that I saw here, it was around probably April. And well, that's 2 or 3 months after the first cases in Europe. So we weren't prepared at first. But right now, things are getting much better. A couple of weeks ago, I'm talking about early May, late April, we had, I mean, tons of patients, severely affected. I mean, they have some severe conditions. But right now, the things are getting much better. And I think that one of the main reasons this is happening is because the government is doing a great job, man. I mean, they are hiring tons of doctors, tons of nurses. I mean, everything is going well. They're opening hospitals everywhere. So yeah, we're working at max capacity. I mean, that's a fact, but we're not yet over our head. So that's great. I mean, the government is doing a great job despite everything they're talking about. But I mean, I think we're handling well.
And you said they're building hospital capacity. So like in the U.S., they were building out in convention centers and hotels. Same thing here. They're using hotels. They're using to develop excess capacity.
Yeah, we actually the government is actually building, or they built one big hospital at Autódromo Hermanos Rodríguez, which is a track race, and it's great, man. I mean, that's one. They build like I don't know, 2 or 3 hospitals only here in Mexico City. So yeah, I mean, we're doing that. And the main thing, though, the main strategy that we did here in Mexico is that the biggest hospitals here are fully dedicated to see COVID-19 patients. I mean, we don't see anything else. We only see these patients. So that gives us a big room of working, so we can only see these patients and we don't have to distract with other things.
You know, the follow-up there is, and we've seen this, I've heard this and I've read this, that in the US we have a similar policy, and that with the benefit of hindsight, because of course we were affected severely in the US long before we were here in Mexico. I say we both times because I am an American, but I live in Mexico and I love it here.
Yeah.
And there were some backlash, may not be the exact right word, but there were some unintended consequences of over-focusing on COVID, and people who heart patients and cancer patients who were not necessarily able to get the treatment they needed. And we kind of had to walk a balancing act. And it seems almost like, to a certain extent, political leadership globally has almost said that a death from COVID is worse than a death from cancer or something like that.
Yeah.
As far as that goes, how do you feel about that sentiment? And do you think the Mexican government's doing a pretty good job of balancing that?
Yeah, man. I mean, I have to say that I'm impressed. At first, I was a little hesitant. I mean, I hesitate about what the strategies of the government were. Because I mean that came to my head immediately. I mean, where are cancer patients going to get the treatment? Heart patients, chronic patients, diabetes. I mean, we have a lot of that here in Mexico, but they're getting their treatment, man. I mean, I guess that 50% of the hospitals are entirely dedicated to see COVID patients, and the other 50% is dedicated to see all the chronic diseases like cancer, diabetes, heart problems, all the things. So yeah, man, I mean, I'm impressed. I have to give it one to the Mexican government, because they're doing a great job with that, man.
Well, so you work at a COVID dedicated hospital, but other hospitals are set aside to make sure that you guys, because I was hoping, as I watched this unfold in the US first, I was hoping that the Mexican government would learn lessons from our mistakes. And so it sounds like, at least to a certain extent, they have. Speaking of, as recently as maybe 10 days ago, a good friend of mine is a nurse, and she was explaining to me that there are still serious shortages in the US in terms of the personal protective equipment. She said that she's been asked to reuse her N95 mask for multiple days in a row. What's the situation in terms of the protective equipment in Mexico? The face shields, the goggles, the gloves, the N95. Yeah. Are there shortages here, or are you guys pretty well stocked up?
Well, once again, I mean, I'm impressed. And I say this so many times because I was hoping for the worst. I mean, we're Mexico, and we have this thing that, well, we didn't do the things the right way. We're only short of this or that. And in this case, from day one, I have all my equipment. I have N95 mask. I have my goggles. I have my gloves. I have I have all the equipment. But that's in my hospital. And I have to say that my hospital is a big hospital, and it's a great hospital. But there are some guys that are not getting enough equipment, so they're struggling. Some even have to get their own equipment. But I mean, I guess it's depend of the hospital, man. I can't complain about my hospital. It's a great hospital, but yeah, some folks are struggling with that.
So, because I was going to ask you if you have friends who are struggling to get the PPE.
Yeah, I have.
Because that's it's been the disparities that exist probably globally, but certainly in the U.S., where I have more friends in this profession than any other country. And it really is a case where one hospital is well stocked and one hospital is not. And I don't know if that's a question of the individual leadership at the hospital or if it's something else. I guess it's kind of hard to tell. And I was also thinking when this first started, I was seeing a lot more masks on the street here than elsewhere. And I kind of thought that perhaps one difference between Mexico and the U.S. is that in Mexico, we still make things here, whereas in the U.S., we don't make anything. So because of that, Mexico may not have had to rely on China to the extent that the U.S. did. And that might be a factor as well. I don't know. What do you think?
Yeah, I mean, that's more a political thing, but I believe that we're getting things from China because actually some of the masks we're using come from China. But I mean, especially in the mask, because from all the personal protection equipment, the mask is the main thing. And yeah, we're getting some from China, but we still have some here. And yeah, I mean, like, I guess this happened all over the world. There are some hospitals that are going to be better. There are some hospitals that are going to have more equipment, and there are some hospitals that are going to have some missing things, and that's what happened right now. But I can't talk about other hospitals. I can only talk from what I see, what I'm living, and the things for us are going well. I mean, we have everything we need. We have all the equipment, so that's great.
I've been paying careful attention to the numbers, and the cases this past week compared with the previous week, the cases went up about 30%, but the testing capacity went up 60%. So obviously you want that ratio to be the higher the better. In Mexico, it's about 2-to-1. But the deaths this past week versus the previous week, nationally I'm talking about, went up 30% compared to a week ago. But you're saying in Mexico City, which has been the hardest hit place, things are sort of settling to a certain extent. What are you hearing from your friends outside of Mexico City? Is it getting worse in other places? Does that explain why the numbers to a certain extent are getting worse, even though what you see with your eyes is that things are getting better?
Yeah, well, things are getting worse in big cities. That's a reality. I mean, we're talking about Monterrey, Guadalajara, Veracruz. I'm actually from Veracruz, and in Veracruz, the cases are getting higher. I mean, they're getting more cases every time. The deaths are going up. So it's something that is happening. But here in Mexico City, the deaths are also going high. I mean, they're getting every time more cases. Some of that is because we're testing more. That's a reality. We're testing more, but we're not testing enough. That's also true. I mean, the numbers that we see on TV or that we see in the papers are not entirely right, but it's a correct estimation as we see in the news. It's only an epidemiological model, so we can estimate the entire number of cases that we have.
Yes, and when I said deaths going up, I didn't mean the total. I meant the comparative percent week by week.
Oh, yeah.
Right. So it sounds like you're saying that to a certain extent, because Mexico, of course, being the major international hub and the biggest city with the most public transportation, the highest population density, you're saying Mexico City probably got hit harder quicker. And so the national numbers that might not look so good are probably due to the cases spiking in Guadalajara, Monterrey, other major cities. What you're seeing with your own eyes is that things are stabilizing, at least to a certain extent, in Mexico City. Is that accurate?
Yeah, it is, but I think that it's also relative. Why? Why I say this? Because a couple of weeks ago, when this thing started, there were only a couple of hospitals dedicated entirely to COVID-19. Talking about, I don't know, let's say 10 hospitals that only see COVID-19. And right now, we have 20 hospitals that see COVID-19. So that explains why in my hospitals, the cases are going down, and we see every time less patients because there are more hospitals. The capacity that we have in our healthcare system is getting bigger. So that's making that things get much better for us. But the cases are going up. I mean, that's why I say that this is relative. I see the things are getting better, but it might not be so true because there are more hospitals and the patients are going to different hospitals instead of only one hospital.
Oh, that makes complete sense. So
yeah.
To sum it up sort of succinctly, you could say that things are still bad and things are still dangerous. The government response has been such that that your hospital is not busting, breaking down the way it almost
exactly
was maybe 2 weeks ago.
Yeah, I mean, 2 weeks ago it was horrible, man. We had 60, 70 patients in the ER. We have 200, 300 patients in hospital bed. So I mean, it was like war. I mean, I can't explain the feeling of that. I mean, that we even had to reject some patients in some times because we're full. We can't see a patient if we don't have a bed, if we don't have oxygen. I mean, we didn't have oxygen, so that summed up everything. But right now, I mean, the government, I guess, that saw that and open up so many hospitals and amplify our healthcare system capacity, and we're doing much better. So yeah, patients are getting the right treatment.
So I know that you're a doctor, not a mathematician, and you're not Nostradamus, the famous prognosticator, but I am curious because you have firsthand knowledge. Give me your outlook for the next several weeks, several months, as far as what you see the trajectory of the virus in Mexico City being.
Well, I guess in a couple of weeks, maybe 2 or 3 weeks, things are going to go flat. I mean, this thing about going high or going down, I guess that 2 or 3 weeks we're going to go in a plateau, and after that, it's going to start to getting down. But we're still going to have cases. I mean, we're still going to have a lot of patients. But I think we're going to get a peak in a couple of weeks. So
you feel like by maybe mid-June, Mexico City will be out of the woods, at least to a certain extent. Of course, the virus is still going to be here. It's still going to be dangerous. But the risk of the entire healthcare system being overwhelmed, you think will probably be in the rearview mirror by maybe June.
That's right. Yeah. And And taking that comment, the real dangerous thing here is that our hospitals don't get enough room to see the patients, and we're out of danger there. We're clear, so we don't have that problem anymore. And I don't think we're gonna see the things that we're seeing in South America or some places in Europe, in Italy that happen. I mean, we're not gonna have that. The virus is gonna still here. Virus is gonna go much more contagious, but our hospitals are going to be just enough. It's going to be enough to see all the patients.
That's really encouraging to hear. Last question is a two-part question. One, what do you think are some of the mistakes in terms of public policy as it relates to healthcare that the Mexican government, and not just the government, but leadership in general, what were some mistakes policy-wise you think were made early on? And then what are some policy recommendations you have moving forward to try to keep things on the right trajectory and to hopefully try to get back to as semi-normal of a life as we can possibly be leading?
Yeah, I think the first mistake that we made here is that we weren't ready for this, or we weren't ready for anything talking about healthcare system. I mean, we have a deficiency with healthcare workers. We don't have enough doctors. We don't have enough nurses. And not because we're not here, because the government, I mean, they don't hire enough people. So that's come from years, I mean, decades. We're talking about something that started, I don't know, in the 60s, in the 70s maybe, and we're still suffering for that. So what the government did right now was to hire everything, and to hire everyone. And that's a reality. I mean, they hired me a couple months ago, and they hire, I don't know, probably thousands of doctors, nurses, and not only us. I mean, technicians. I mean, they hire lots of people. So what I think that the mistake was here was to not be ready, and maybe not thinking in the future that this might happen. And a mistake now would be to fire everyone, or when they contracts end, to let the people go, because it's gonna be the same, but only without COVID-19. I mean, if it's not COVID-19, it's gonna be heart disease, it's gonna be diabetes, and the healthcare system is gonna be full, and it's gonna be the same thing, but only that without COVID-19. So if they still have enough capacity, enough money, I don't know how politics works, but if they can keep most of the people, or at least 50% of the people that they hire, things are gonna be like 100% better. So I hope that that's something that the politicians have in mind, and maybe that would make a difference here.
And my last question is, I'm curious because I don't necessarily understand the Constitution here in Mexico. If a doctor, not even you, don't make it specific or personal, if a doctor really spoke out aggressively against the government, would they be in trouble? Would they lose their job? Would they, like, for example, in the US, it's complicated because of the Free Speech First Amendment. You're not supposed to be able to fire a government employee who's a whistleblower or who speaks his mind. What's the situation like constitutionally on that topic here in Mexico?
Well, it depends a lot where you work, because some of us have some confidential agreement to say something, which is your contract. I mean, you can't talk about or discuss about patients or things like that. But we're actually pretty free. I mean, I can talk about whatever thing, anything I want about the government. But as anything, I mean, not only us as healthcare workers. I mean, in any aspect in Mexico, if you talk bad about the government, you have to know that you're going to have some repercussions. I mean, you can't do it that free. So you have to be careful. But right now, I mean, I have to say that there's nothing wrong right now. I mean, and that's great. I mean, I have absolutely anything to say bad about this government at this right now, or at least about COVID-19, because there are a lot of things that we can talk about politics and how this new government is acting. But in this scenario where we're fighting such a big problem and such an incredible situation, which is COVID-19, they're doing an amazing job. And someone had to say it because people are getting trying to say that the government is doing the things the wrong way and this and that, and maybe they're not doing it great. I mean, some countries have definitely doing things better or did things better, but for us, I think we're doing just a great job.
Yeah, especially it sounds like if you compare your concerns with what the reality turned out to be,
yeah,
the Mexican government's response it has really been outstanding.
Yeah, man. I mean, I thought that we're going to be like zombie movies. I mean, that we're going to have people dying on the streets, which is not something crazy to say because this is happening in South America. I mean, we start to see dead people on the streets. We start to see doctors working without any equipment. And well, I mean, that's horrifying. And I was hoping that to happen here in Mexico. I mean, at the beginning of the pandemic, I was hysterical. I thought that everything was going to go down, that healthcare system was gonna. I mean, I thought everyone gonna die, and that didn't happen. We are responding nice, and as you said, comparison to what I thought that it was going to be, this is 1,000 times better.
Well, Dr. Ruiz, I look forward to when there's beer again in Mexico and the bars are open and life's a little more normal. I'm definitely going to take you out to Chile 1 or 2. And I really appreciate your time. And hopefully we'll have you on maybe sometime in a couple of months as an update as this thing keeps progressing here in Mexico. And again, thank you so much for your time.
For sure, Peter. Thank you. And have a good one, man.